Hi everyone, I'm François Picard. Welcome to the France 24 debate. Now that the nightly applause has died down here in France, will those essential care workers be forgotten?
Ils sont tapés sur des casseroles, ils ont mis des bougies pour soutenir les soignants. Mais bon, je pense qu'il faut aller au-delà et puis rappeler au gouvernement qu'il faut une revalorisation des salaires, des embauches.
After France clapped for its carers during lockdown, will the risks taken on the front line of the coronavirus pandemic be rewarded? Will long-running demands for more means be met? Talks are already underway between the state and healthcare sector leaders, the government promising major announcements for the start of next month. But those essential workers are worrying that with the deficit skyrocketing, the bean counters at the finance ministry will once again squeeze them. Organizers of the march in Paris say their Tuesday rally was hijacked by those who started chanting all against the police. We'll be asking about the optics of the violence witnessed Tuesday in the French capital and, well, about the French way of handling this crisis. The finger-pointing has already long begun with class action lawsuits now in the works, like the one launched last week in Italy, and a parliamentary inquiry underway in Paris as of Tuesday to ask about the initial response, the mixed messages, the depletion of the nation's face mask stockpile, testing, the lack of coordination with European neighbors. Does the answer to better healthcare lie at the local level, the national level, or at the level of a continent that's never up to now had a common European healthcare policy? Today in the France 24 debate, we're looking at the fury of France's healthcare workers. Joining us from the southern city of Montpellier is Dr. Phillip Nikesh, co-founder of the collective C19, more than 600 doctors who are suing the government for their handling of the crisis. You're also a general practitioner. Thank you for joining us.
Hello.
We want to welcome from the French capital, Jakub Hessler, entrepreneur and political commentator. Welcome back to the show.
Hi.
France 24's Chris Moore covered the big demonstration in Paris on Tuesday. Thanks for being with us, Chris.
Hi, François.
Yeah, that demonstration you were at, we kind of saw both worlds. On the one hand, there were scenes of solidarity between the police and healthcare workers. After all, police who were also on the front line during the pandemic. So there was that image, but then later it turned violent with hard left militants taking on the cops. And in one particular case, at least one healthcare worker who was forcefully taken out. The images have gone viral. You could see there of what happened at that particular moment.
Reculez. Tu recules. Je veux ma ventoline. Je veux ma ventoline. Allez, on travaille, monsieur. On travaille, monsieur. S'il vous plaît.
Moments earlier, before that what we saw transpire with her, effectively I can't breathe moment when she's saying she wants her Ventolin. There had been images that were captured by a French news channel, BFM, where you see her throwing things at police. So very much on social networks now, two sides to this story are being played out according to where your sympathies lie. Let me begin, before I go to Chris Moore, with you, Dr. Phillip Nikesh.
Law says there has to be a just reaction about something's wrong. When this nurse threw a little stone, you see, a little stone, she had walked all the COVID crisis with risk, and she threw because she's disgusted with everything she heard about the crisis. She made something she didn't have to make. It's throwing a little stone on a helm where you see there are soldiers in front of them, and you of course you can react and arrest her. But why do you have to do such a big violence? Why don't you use the law? The law says just reaction. Is it a just reaction?
All right. So the full disclosure: her daughter Imen Melaz works as a producer at France 24, and she put out this tweet afterwards. That woman, that's my mother, 50 years old, a nurse. She worked for 3 months between 12 and 14 hours a day, caught COVID. Today, she was demonstrating so that her salary can be raised, that we recognize the work she's accomplished. She's asthmatic. She was wearing she was wearing her hospital gown. She measures 1.55 meters.
Sure.
She was still in police custody as we were recording this show earlier in the day, Jakob Hessler. So that incident, it's a bit of a, you could say, a digest of a lot of frustrations in a lot of directions at this moment here in France.
Well, no, I think the Dr. Nikesh, I think you formulated quite well. The question is about not whether there is the law. The question is, what is the proportionate use of force when you are in a situation that is at this? And that is not a legal question. That's a question of living together and of defining standards about how you, as a government or as a state, you react to something that in very profound sense is perceived as legitimate by many people. And so I think I personally think it's a very unnecessary use of force, because it can't be that difficult to identify that a 1.55 meters nurse in medical gear is not a extremist black bloc left-wing anarchist that is about to go and burn half of Paris. I think the problem is, what is the situation we then put policemen in so that they can't make the proper judgment, which is, in that situation, a leader of this group should make this judgment, and it's not happening. And I think it points to overall what I think the biggest problem with this crisis, and now that we're trying to understand it, is I think apart from individual failures, there is a systemic failure. There's a systemic failure about how the different levels of government work, who does what at what level. And so people are, on the one hand, infantilized, and then at the same time they're being brandished, etc. And that just is not coherent. And I think, I don't think that the law pursuits will bring light to this, nor the fact that the government just throws more money at the problem. I think there needs to be a questioning about why the system failed.
Why the system failed. I want to get back to it, but first I want to ask Chris Moore at this point. Chris, what was your feeling? Because we had peaceful marches the same day in other cities in France. What was your feeling during that Paris demonstration?
Well, it was quite a big demonstration to start off with, and there were several different stories that went on within it. Really, the images that you've just been broadcasting there and other ones of clashes between the riot police and protesters, obviously, they're always going to be the ones that make the headlines, but they kind of happen really on the fringe of it. Often, violence kicks off at the end of these demonstrations, and there are a lot of demonstrations here in the French capital. I've covered probably dozens, even hundreds of them over the years. This time, it was kind of an advanced party, it seems, which was the spark which set this off, and you've seen how the police reacted there. The vast majority of the demonstration was simply healthcare workers demanding better rights, demanding more staff be hired, demanding better equipment, and the thanks they received during the COVID crisis, for their work on the front line, not be forgotten. I should point out that all of this actually goes back pre-COVID as well. I mean, there have been
I was going
many
to say, Chris,
demonstrations
because you
involving-
covered demonstrations of healthcare workers. We didn't call them essential workers yet, just a few months ago.
That's right, yes. It was going on for months, even a year or so before the COVID crisis. And the complaints were the same, namely that the government, and not just the Macron government, but those that went before it, have been slowly chipping away at the resources available to public hospitals here in France. They called the alarm bell, saying that the sector was already in crisis before the pandemic hit. And that's really the context in which you should see it. Obviously, the pandemic has brought things into very sharp focus. It's kind of forced the government to recognise healthcare workers, saying, OK, we need a resetting of relations. We need to increase pay, etc. They've said they're looking at ways of doing that. And obviously, we were talking about the French protesting there. This is also a way of seeking to force the government's arm and making sure that it does hold its promises at a time when, as I said, Emmanuel Macron has promised better conditions for healthcare workers. And so it's a political negotiation as well.
Yeah, how that optics will play out in those negotiations is a key question. What is certain is that if you go far from the center of the French capital, and you were just a few blocks away from the National Assembly where all that transpired, you see that the post-pandemic world is sparking a lot of frustration among healthcare workers. France 24's Karina Chabour went to the Vosges region, just a little bit west of Mulhouse, one of those hotspots for COVID back in January. It's a report read by Brian Quinn.
At this hospital in eastern France, the pulmonary department is gradually getting back to normal.
Un patient qui vient pour une infection urinaire responsable d'une décompensation cardiaque. Un patient connu du service, on a l'habitude. Et c'est des patients qu'on ne voyait plus pendant la période du Covid. Et là, ils reviennent tous depuis à peu près un mois.
There are just 6 coronavirus patients here now compared to 110 at the peak of the crisis. The small facility near the German border was the first to confront the epidemic in the Vosges region. As emergency reinforcements wind down, caregivers are now confronting another battle.
Autant pendant la crise, on l'a faite, on l'a subie, et on nous a redonné quand même à un moment les moyens de faire face. Tandis que maintenant, on est en train de nous retirer tout ça, et on se retrouve de nouveau comme on était avant, c'est-à-dire on nous redemande plus avec moins.
C'est clair, après ce qu'on a vécu, nous renlever du personnel, ça va être une catastrophe.
Voilà, vous voyez le manque de moyens, c'est les internes qui brancardent.
C'est les internes qui brancardent.
Voilà.
On est polyvalent, hein. Polyvalent.
The indebted hospital is in the midst of a restructuring. It lost 20 beds last year. The cardiology department was closed 2 years ago. Dr. Chamas, who deals with the administration, blames a system of financing based on the number of operations carried out.
On n'est pas là pour faire des actes. L'hôpital public il est censé de prendre en charge des malades lourds qui coûtent cher. On est d'abord pour soigner, c'est pas pour voir combien ce patient va nous coûter.
It's a profitability mindset that has long grated on emergency services.
Pas de fièvre, des sueurs, des frissons, des courbatures.
Non, pas du tout.
Here, patients are still triaged as they come in, as staff adapt to the new normal. ER Chief Marie Breffa has been requesting more staff for a year. She says a return to budget cuts will be fatal to her department.
À un moment donné, quand on a tout donné comme ce qu'on a donné les 3 derniers mois, et qu'on voit que finalement, la prochaine, comment on fera si on a encore moins, si les choses se délitent encore plus, on n'y arrivera pas. Et donc à un moment donné, c'est l'instinct de survie qui parle. Et donc je ne sais pas si on a encore envie de rester dans un système qui nous maltraite.
President Emmanuel Macron has promised a massive plan to help French public hospitals.
Si je peux vous soutenir, je le fais à 100%.
Merci. Merci.
In the meantime, Marie and her colleagues can count on the gratitude of the French people.
Dr. Phillip Nikesh, that gratitude, where you are in Montpellier, how should that be parlayed, I should say, into more means for the healthcare sector?
The gratitude is something you deserve to have when you do your job well, you see. And I always had about my patients. Because when you talk with your patients, You don't lie them. You see, you tell them the truth. And if you don't know, you tell them, I'm searching what disease, I'm looking after your case, I'm taking care. That's the way to treat your patient. The way the government treat us wasn't this way. They lied all the time, and they continue to do so.
They continue to lie, you say, because we heard the French president in his speech, Emmanuel Macron, promised there'd be more, that it wouldn't be like before, and that we would pay attention to those essential care workers.
Sure, with the big Ségur, but it's how do you say, it's a masquerade. It's something.
The Ségur, just explain to our viewers.
The words are always, since a long time ago.
Just explain to our viewers, the Ségur means, Ségur is the name of the street where there's the health.
It's the new plane they make to.
They're having a national dialogue. You're saying that national dialogue ahead of those big announcements by the government is a masquerade?
Yes, it is. It is for sure. I'm not the only. I'm not the only who tell. The big professor who was involved in the hospital who tell the same thing, because they know everything. They handle with the people, with the government, and they see that nothing is going on the change. It's just words. It's just lies, like always.
Just words, just lies. Chris Moore, what were people telling you during the demonstration?
Well, as I said, it was really anger over something which dated back to before the COVID crisis, which the doctor was just talking about there, namely years, even decades of under-resourced public hospitals here in France. I think one of the interesting things was that if you look from outside France, if you look at press coverage of the COVID crisis around the world, France was generally thought to have done not excellently, but kind of okay, not perhaps as well as Germany, but better than certain other nations in terms of locking down relatively early, in terms of preventing a certain amount of loss of life. But again, many of those healthcare workers telling us that the crisis really exposed what they feared the most. The French healthcare system, when pushed to its maximum limits by that, it just about held out compared to, for example, the scenes we saw in northern Italy. But there was at one point during the pandemic, for example, where France had to call in help from its neighbours. From Germany, there was a lot of improvisation went on. Remember those hospital TGVs that were taking patients around the country, medical flights, etc. And many of those medics saying that this crisis just exposed something which has been going on for a long time, namely that the system is constantly operating on very tight margins, or indeed is constantly under-resourced. Those margins are in constant danger of crackling, really.
Jakob Hessler, we did a previous show at the height of the lockdown where you said the biggest problem in France isn't so much in the emergency treatment of those who caught COVID, but more a systemic problem where the public hospitals don't speak to the private labs, who don't speak to those in charge of emergency.
Yeah, I think there's two things in there. There is, and when we debate this now, we debate two things. One is, how can we improve the state of preparation to be ready for a new pandemic or a next wave that might come in October or November or whenever. And there's also an underlying problem of how the healthcare sector is organized, and how increasingly what's happened is that the emergency at the hospitals became the go-to doctor for everyone. And you can't blame the emergency room of the hospital for the fact that it became the de facto doctor for large parts of the population. And they were not equipped with money and people to do so. And that to me has to do with the fact, and you could see it in the crisis playing out, that in general, the notion between the general practitioners, ambulatory care, and the hospital, that system hasn't worked. The hospital held, fortunately, and thank God. But I think, we need to address the structural issues of the hospital, but I don't think we can do that without rethinking, which is what was originally planned, which was how do we better integrate the care for people through their general practitioners, through ambulatory care. Because when you look at why did, for example, Austria do so well, or some cities in Germany, what they did is that they paid the general practitioners in what they called the Corona taxi. If you had a symptom, you wouldn't call the ambulance that was trying to get you out of the hospital, but they were sending you someone who would look at how you're doing, and if you had symptoms, would send in a doctor who would come to your home and would look, and he would follow up with you, care, and then look when you needed to go to the hospital. And I think in the French response, we had the ambulance system basically triaging between, no, you're not sick enough for the hospital, so just go home. And where were they sent? Who would follow up? Who would tell them what to do? Who would care for them? That whole part was left off, and let alone the part of the elderly care homes. The elderly care homes themselves, they messaged that they had a problem. It took more than a week to respond because everything had to be decided at the top. One couldn't say, please, in Montpellier, in Toulouse, develop your test and do it. No, it had to be everything central. They didn't say there are general rules about how to behave in an epidemic. You need to protect your population. Do what you can. Here are how we can help you. And when we have more means, we'll let you know and give them to you. No, it was wait. We need to decide first. And then when they lack equipment due to whatever and whoever errors, they were trying to spin stories around why that was, rather than just saying the things as they are. And the combination of that, I think, is this systemic failure to respond to this epidemic, but which is a systemic problem for the overall healthcare system. And it needs more money, but not only, I think.
Dr. Phillip Nikesh, just to remind our viewers, you're a general practitioner.
I spent the half of my practice like a family doctor, and now I'm working for a clinic. But so I see the two ways of thinking about the way the government thinks about healthcare.
Okay, so if there is a second wave, how would you like to see the workloads go differently?
For sure, you have to give responsibilities for the health, for the family doctor, who is the prime care of the population. For sure, you have to let them decide. You have to let them treat. There was many rules who went wrong in this crisis, where the doctor can't give one antibiotic. Now they are pursued by their order and maybe by the law, because they give some antibiotic for lung infection, atypical lung infection. What's going on in this city? In this?
And just to be clear, that ban on giving a specific antibiotic, it came all the way from the top, from Paris?
There's some people. He's talking about the systemic problem. No, I'm talking about who gives the orders.
And who gives the orders?
Who gives the orders to violate this nurse? Who gives the orders to avoid that a family doctor can't make some tests, can't have some protection? Who gives the orders? There are some people behind. It's not a system. It's a systemic problem, and there's nobody behind this systemic problem. There's some people behind, and they have to tell us the truth for once. Just the truth. Tell us the truth. What's going on?
And Dr. Nikesh, just to remind our viewers, you yourself caught COVID-19 early on.
At the very beginning, I felt, because I heard about the flu. It's a flu. It's coming on, and nobody who how do you say, les soignants, the healthcare are taking some protection, because the government says it's nothing, it's a flu, and many doctors, I can't. They wasn't on the television, and the professor said it's just a flu, don't worry, and some us believe it and died because they believed it. It's
Chris,
a very, very bad thing what's going on. Very bad lie.
Chris Moore, before we let you go, with the people you spoke with in Tuesday's march, were they looking back at what happened over the last 3-4 months, or were they looking ahead in case there is that second wave?
Of course, they're looking ahead and fearful of the potential for a second wave, as everybody. And you've just heard your other guests going through some of the reasons that something could be, that sort of ways that things could improve in the kind of the logistics, the command chain, where people go, where they feel safe, which parts of the healthcare system take care of COVID patients. But as I've said, it's a story that's been going on. It's been going on for a long time. It predates the COVID crisis. This one of under-resourcing, as far as many medics see it, within the public care sector.
But see, one of the things that is typical is in the coordination of this crisis, you had these Ministry of Healthcare dependencies down to these regional healthcare agencies. And then at the parallel, you had the direct top-down from the government through its prefects, who are usually coordinating between the ministries and what they want. And that model just doesn't, and it didn't work. And it didn't work because it was too centralized, and it doesn't work because it had two chains of command. And of course, it wasn't helped by the fact that the government before all this happened, this has been the most centralized top-down Jacobite government that France has seen in a very long time. Despite what they say, this is something where everyone is decided at the top. If then wrong decisions are taken at the top, it has all the more devastating impact. If there's responsibility for local people to do what's right and trust them that they're competent, a wrong decision at the top isn't as problematic as it turned out to be. And that's, I think, what I call systemic failure. It doesn't mean that individuals didn't take wrong decisions and need to be held accountable for. But my point is, if we don't fix this, we don't have a robust enough system so that next time this is happening, the response can be better. Even if they take a few better decisions, the response will not be as good as it can be.
All right. I want to thank Chris Moore for joining us, France 24's correspondent who covered that demonstration on Tuesday in the French capital. And at this point, we'd like to go to Paris and bring in Dr. JeanJacques Zambooffski, who teaches public health at the University of Paris Descartes. It's nice to see you in a restaurant in Paris.
Absolutely. It was just opened today. It's the first lunch they're serving.
Dr. Zambooffski, tell us now, we've just been talking about what went wrong during this crisis, and the rest of our panel, most notably, putting the accent on the top-down communication where people didn't own up enough for mistakes. I guess the biggest example of that was face masks, where we had the man in charge of public health telling them they weren't necessary. Then the country realizing that the stockpile had been depleted over a matter of decades, and finally then becoming mandatory on public transport.
Well, of course, there were things which can now appear like being mistakes, but at the time that they would discover how deeply we were not prepared. People would expect that it would be easy to get some masks, it was easy to buy them. They did not realize that buying them meant buy them from China, and China closed its borders and its factories. So there was, of course, a lack of precautions, a lack of forecast. And now it's easy to criticize, but the thing is, this has been the case for decades. And this also applies to the hospital budget and to the health budget as a whole. If you pay a general practitioner 25 euros, which is something like 26 or 27 US dollars for a consultation, it's not honest. You can expect that it would really give the best of the quality. So some of them, unfortunately, are going to quantity rather than quality. And same applies to the hospitals, where some hospitals managers are.
Okay, but looking ahead, Dr. Zambooffski, looking ahead now, the news out of China is that they had a new cluster in Beijing, forcing the closure of schools. They're taking it very seriously. If we have new clusters in France, what should be the modus operandi?
The Chinese have a certain experience of what ought to be done, but they also have tools, and they have. It's easy in China to close an area in Beijing or in another Chinese city. It would, of course, be very, very complicated and difficult to do the same thing in France. Now we have clusters. We have about 150 locations in France where the virus is still vivid and still having some patients, new patients every day. But they are quite localized and quite well kept, well managed. So people are more cautious than definitely they were 2 or 3 months ago. We still ignore a certain number of things about this virus, and we still don't know how to handle exactly the thing. You know, people. I'm in a restaurant right now. Yesterday it was forbidden. What is the difference between yesterday and today? I don't know. Today I can speak to you without a mask. Yesterday I could not even enter the restaurant, and I had to be in the terrace, but with a mask. So people are learning day after day, and they take measures which are halfway between public health and economics and sociologics and politics. It's a tricky complication. In China, they don't have the same kind of problem. The party, the authority says, you do not enter this zone, and everybody has to obey. Otherwise, they disappear. We can't do this. We can't do this in France. We can't do it in Italy or anywhere else in the world, but in China or in Northern Korea.
Do you agree with that, Dr. Nikesh?
For sure not. The people at the beginning, the lie was, we are not the same culture as Korea, and we can put some mask. We had the government talker, la parole, Sibeth Ndiaye, was joking with the mask, that we can't. The population is too unclever to know how to keep it on the mouth. It's not a matter of culture. It's a matter of education, and I always educate my patients, and we're telling her they understand everything, and they just want to know the truth, not lies. They just want to know the truth. And if you tell them it's dangerous, put the mask, they put the mask, because they have confidence with the doctor.
So, Dr. Nikesh, you're in a collective that is organizing a class action lawsuit, a bit like the suit that we saw last week launched in Bergamo, Italy, against the government over the handling of COVID-19. But do you take Dr. Zambooffski's point that this is such an unprecedented situation? You can't blame the government for everything.
That's not what the minister, the health minister tells it in a well-known paper that she knew everything's going on. I don't know, because I'm not looking after what's going on in Australia and when the flu is coming, but she knew, and she tell it very exactly. I knew what's going on. It's a tsunami is coming on. We don't have to make the elections. That's what our government says.
All right, so we have what we just heard from Dr. Nikesh, and we have the language that was employed in his speech on Sunday evening by the President Emmanuel Macron.
The fight against the virus is not over, but I am happy with you about this first victory against the pandemic. My thoughts are with those who have died, their families, whose grieving has been even more cruel due to the circumstances of the pandemic.
Jakob Hessler, when you compare the messaging of Emmanuel Macron to that of the leaders in your native Germany, what are your thoughts?
Well, I'm always very wary of militaristic language, because to me, the answer to an epidemic is not a battle. And I think it's putting us up for the wrong metaphor. And it's been the wrong metaphor all along, with slight variations. But I think it leads to this, on the one hand, unmet expectations that the generals up there will do all that's right and tell us what to do, when in fact they can't, and they shouldn't pretend that they can. And at the same time, it sort of tries to create unity against an external enemy. But the problem of this is an eminently social question, is if you want to have better protection, you need to educate people about the right gestures, about washing hands, using masks. It's the same thing when you look at the flu epidemic, Spanish flu in 1919. You can compare US cities that imposed wearing masks, and they were not FPP2, and they were probably homemade and really bad. But they were much better, and these cities had much less casualties than the cities that didn't. It's very simple things that should have been done, but I think we got into this whole martial militaristic language, and that suddenly prevented this education from taking place and people taking more responsibility. And I think the people...
Okay, that was Jakob Hessler, that was at the outset. Now, when you go out on a daily basis in Paris, do you get the sense that citizens have factored it in? And if there is a second wave, well, we'll all be a little bit readier for it?
Well, I would say citizens are probably a little bit readier, and they are cautious. I mean, yes, some are not, but on average, people are more cautious. People are not suicidal, and, yes, some people are less compliant than others, but I think you can see a difference. The question is, will the test and tracing system work if we get a bigger outbreak? At the moment, we have some people at the Social Security who do telephone tracking. If ever we get a bigger number of, herds, outbreaks, this system is going to explode. Do we have today a functioning way of, and it's not linked to these apps. I think that's the other big mistake, is there were too many people who believe in mathematics and in apps and technology to solve the problem, when it's a human interaction issue. The successful test and tracing in Austria and in Germany works very, very, and even in Massachusetts, once they put it in place, works very low tech. It's people picking up a phone, calling people, asking whom they see. Call those. It's not perfect. It's not as elegant as a technology solution that does it all by itself, but it works. It works, and it's tried and tested. And I find we rely too much on taking large-scale mathematical models to the truth, and then we say we're going to have an app that solves this. That dream is not going to materialize. I think we need to focus more on educating ourselves and getting ready. So how will be the general practitioner's response? How will the government empower general practitioners to be the first line of defense? Equip them with all they need to know and to do, with the leeway to take the right action. That, to me, is the preparation for the second wave that we need to take. Whether this wave then comes or not is another matter, but it's the preparation paradox. If we prepare and then it doesn't come, everyone will say we wasted the money, but it's probably money well spent, I would say.
Contact tracing groups in France, they're being called the sanitary brigade, la brigade sanitaire. One final question, Dr. Nikesh, are we getting better at testing?
For sure not. For sure not. We have lack of everything. The test is not active now.
But what about those sanitary brigades, those brigades sanitaires? Are they working where you are?
Yesterday there was where I was working a school who was closed because one of the incidents in the school had COVID. One of the personnel who carry about children, but they test everybody like it should be of the school? For sure not. For sure not. We don't need a second wave to explode. It's exploded now. From now on, it's exploded.
Jakob
Don't
Hessler?
work.
But I think when you look at the test, that is the real, and it's happened several times. It happened with the inability or the inability to do the viral test, the PCR test, and to just say, let people develop them locally like other countries have done. But then when the retroviral test came, the Roche test, even there, suddenly a French agency that has never done anything says, I'm responsible for making sure antiviral tests are valid. Have they ever emitted any opinion on HIV tests? Most doctors I know didn't even know this agency existed. Took another 3 weeks to validate a test which had been validated and used in machines in 5 large countries like Germany, UK, and other. Why do you need, and then you had 2 instances having to approve this test, which then disagreed exactly on the way it should be used. That's the kind of thing which doesn't work. It just doesn't work. And I think we need to understand, we need to stop the way of functioning in this sort of hierarchical top-down way.
It's certainly plenty of food for thought for that parliamentary committee that started their work this week. Jakub Hessler, I want to thank you so much for joining us from Paris. I want to thank as well Dr. JeanJacques Zambooffski for being with us from the French capital. Dr. Phillip Nikesh, best of luck to you in your practice down in Montpellier. And we want to thank you for being with us here in the France 24 debate.
Some of the world's most influential people talk to France 24.
Government cannot do much promotion of human value.
Politicians.
E acho que sem política não há democracia.
Scientists, athletes and artists.
Nous les femmes, si on se serre les coudes, on peut vraiment avoir une action très très positive sur le monde.
The American Film Festival in Deauville.
Get all the insight.
The government is still spying.
And the voices that matter on France 24.
Liberté, égalité, actualité.